Imagine you at the park, you're walking, you're having a good time, you are exercising, and then you enjoying the fresh air, and then suddenly you have some cramping in your legs. Now, you stop a little bit, you take a break, and the pain goes away. And then you continue your walk, you're walking again, and suddenly you have more pain and your cramps in your legs. Well, if this sounds familiar to you, you may be having what we call peripheral artery disease. So let me tell you a little bit about PAD, or peripheral artery disease. What is this? So picture this, your arteries are like super highways. They take blood from your heart to your legs, to your brain, to everywhere of your body. So you have blood with oxygen that needs to be carried throughout your body. So in peripheral artery disease, what happens is you have these super highways, they get narrowed, they get plugged up with sticky plaques of fats and bad cholesterol. So over time, what happened, there is some reduced blood flow going to your legs, and that can create a lot of problem over time. You may have cramps when you're walking, and this cramp will go away when you take a break. When you continue walking, you have pain again. We call that classically, in medical term, intermittent claudication. Is it pain when you're walking? This pain stops when you get a break, and when you continue walking, you have the pain again. That's one of the symptoms that can happen when people have peripheral artery disease. This is a really sneaky condition that millions of Americans have, and a lot of them, they don't even know they have it. People with peripheral artery disease can have also numbness in their legs. They can have also these cramps. They can have weakness also. You can end up with open wounds or ulcers or open sores in your legs or in your feet, precisely. And you can even have what we call gangrene, which is like when you have the blue toes or these feet, really dark, purplish discoloration. And sometimes amputation can occur also. So it's very important, this condition, to know and to be aware about. So if you are having any risk factors, like, you're over 50 years old with diabetes, or you smoking, or you have high blood pressure, or you have high cholesterol, or you have family history of artery problem, and you have these symptoms, you need to get checked. You need to go to your doctor and talk about it. Now, when you go to your doctor, of course, your primary care doctor may take care of that, or they may send you to a specialized clinic like our clinic, and we'll be happy to take care of you. When you come here, we do a lot of stuff. We will talk to you, ask you questions about what's going on. We will do an examination of your legs. We will order some tests. Sometimes we order something called an ankle brachial index, which is like a test, really super easy, where we check your blood pressure of your arms and of your ankles. And if this pressure is really low, you may be having PAD, which is the peripheral artery disease. Sometimes we may need to do an ultrasound of your legs also to see how the blood flow of your arteries is working. So there are different tests we can do, but the most important thing is if you have one of these signs or symptoms, you need to get it checked, please, because peripheral artery disease is a really sneaky condition, but that can lead to a lot of complications, including amputation. And we don't want that to happen.